Do you know the early warning signs of a stroke that could save your life? Imagine a world where up to 80% of major strokes could be prevented. Sounds incredible, doesn't it? Yet, according to a 2017 study, this could be our reality if we all learned to recognize the early warning signs of a stroke and sought immediate medical attention. These initial signals are often transient ischemic attacks, or TIAs, brief episodes of stroke-like symptoms that can occur days before a major stroke. Recognizing and responding to these signs could not only save lives, but also significantly minimize long-term damage such as paralysis and loss of independence. In the following scenes, we will delve into the 9 critical warning signs of a stroke. So let's embark on this eye-opening journey together. Stay tuned to learn about the 9 critical warning signs of a stroke. High blood pressure is a major risk factor for stroke, with temporary spikes being serious warning signs. It's like a pressure washer. When the pressure is too high, it can damage the surfaces it touches. In the body, high blood pressure damages the walls of your arteries, making them more prone to blockages that can lead to a stroke. Furthermore, temporary spikes in blood pressure, often triggered by stress or certain medications, can strain already weakened arteries, potentially leading to a stroke. This is why it's so crucial to monitor your blood pressure regularly. If it's consistently high or you notice sudden spikes, it's time to consult a healthcare professional. Management can be as simple as lifestyle changes, such as a healthier diet and regular exercise, or may involve medication in some cases. Remember, high blood pressure often has no symptoms, so don't wait for a warning sign. Make sure to keep your blood pressure in check. One of the earliest yet frequently overlooked signs is sudden, unexplained drops in energy. Yes, we're talking about sudden fatigue and weakness. It's easy to dismiss these symptoms as mere results of a stressful day or lack of sleep, but when they occur out of the blue, they might be signaling something far more serious: a stroke. These unexpected bouts of tiredness and weakness happen because strokes affect the blood flow to the brain. This disruption in circulation can leave you feeling drained, sapped of all energy. You might even experience weakness in your limbs, making it difficult to hold objects, stand, or walk. So, if you or someone around you experience an abrupt plunge in energy levels or sudden weakness, it's crucial to take note. These symptoms might be your body's way of sounding the alarm. Remember, early detection could be the key to preventing major strokes and their long-term damage. Don't ignore sudden fatigue and weakness. Disruption in blood flow can impact speech, understanding, and decision-making. Visual disturbances like blurriness or double vision are red flags. Imagine, if you will, that you're in the middle of a conversation when your words suddenly start to jumble, or the world around you becomes blurred or doubled. This can be more than mere confusion or a simple case of tired eyes. These are potential warning signs of a stroke, and they demand immediate attention. Let's delve into the fascinating story of Dr. Bolte Taylor, a neuroanatomist who experienced a stroke firsthand. One morning, Dr. Taylor woke up to a pulsating pain behind her left eye. As the day went on, she noticed that her body was slowing down and her speech was slurred. She couldn't walk straight, and her vision was distorted. Despite her training and expertise, Dr. Taylor didn't initially realize she was having a stroke. It was her confusion and inability to perform simple tasks that eventually led her to seek help. This story emphasizes how easy it can be to dismiss these signs as mere inconveniences or fatigue. But if we know what to look out for, we can act swiftly and decisively. A stroke doesn't always come with a warning, but when it does, the signs can often be subtle and easy to overlook. Confusion can manifest as trouble understanding speech or difficulty speaking and forming sentences. It can also present as a sudden inability to perform simple tasks or make decisions. Abnormal vision, another potential sign of a stroke, can appear as blurriness, double vision, or even loss of vision in one or both eyes. It's important to note that these symptoms can occur individually or together. These signs are your body's way of alerting you that something is seriously wrong. It's akin to a smoke alarm going off before a fire spreads. By recognizing these early warning signs and acting promptly, we can potentially prevent a stroke or significantly minimize its impact. So remember this: If you notice any sudden confusion or visual disturbances, seek medical help immediately. Stress exacerbates risk factors for stroke, influencing blood pressure, heart function, and blood vessel health. Numbness or weakness on one side of the body indicates interference in brain function. When we talk about stress, we're not just referring to a bad day at work or a heated argument with a friend. We're talking about chronic stress, the kind that lingers and builds up over time. This type of stress can cause your blood pressure to rise, your heart to work harder, and your blood vessels to narrow, all of which can increase your risk for a stroke. When under stress, your body releases stress hormones like cortisol and adrenaline. These hormones cause your heart rate to speed up and your blood vessels to constrict, pushing up your blood pressure. Over time, high blood pressure can damage your blood vessels, making them more susceptible to the formation of clots, the culprits behind most strokes. But stress isn't the only warning sign we need to be aware of. A sudden feeling of numbness or weakness on one side of your body can be a major red flag. This could mean your brain isn't communicating properly with your muscles, possibly due to a disruption in blood flow. You might notice a sudden droop in one side of your face, an arm that feels heavy or refuses to cooperate, or a leg that drags or buckles unexpectedly. This isn't something to brush off or wait out. It's a sign that something is amiss in your brain, and it requires immediate attention. So what can you do? First, recognize the signs. Understand that chronic stress isn't just an inconvenience, it's a health risk. And if you notice a sudden feeling of numbness or weakness on one side of your body, don't hesitate. Seek medical attention immediately. Remember, your body is constantly communicating with you, giving you signs and signals. It's up to you to listen and respond appropriately. Stay aware of your stress levels and any sudden changes in your body's strength or feeling. Dizziness or problems with coordination occur due to disruptions in the brain's command center. Unexplained nausea or vomiting can be early warning signs. A severe headache could precede a type of stroke. But why does this happen? Well, when it comes to dizziness or coordination issues, imagine your brain as the command center for your body's movement. When a stroke occurs, it's like a power outage in that center. This can cause sudden and sometimes severe dizziness, along with problems with balance and coordination. Remember, your brain is responsible for keeping you upright and moving smoothly, so any hiccups in this process might be a red flag. Now, on to unexplained nausea or vomiting. This may seem more suited to a stomach bug than a brain issue, right? However, the brain and the digestive system are closely linked. When a stroke disrupts normal brain function, it can also interfere with the signals sent to the digestive system, leading to feelings of nausea or even vomiting. If these symptoms appear suddenly and without a clear cause, they could be warning signs of a stroke. Finally, we have the severe headache, often described as a sentinel headache. This is no ordinary headache. It's sudden, severe, and unlike any headache you've experienced before. It could precede a subarachnoid hemorrhage, a type of stroke caused by bleeding in the space surrounding the brain. A sentinel headache is often your body's way of warning you that something serious is about to happen. So, like a sentry standing guard, these symptoms, dizziness, unexplained nausea, and a severe headache, are there to alert you. They are nature's early warning system, telling you that your brain could be in danger. When these signs appear, it's crucial to seek immediate medical attention. And remember, time is of the essence. The sooner you get treatment, the better your chances of minimizing damage and making a full recovery. Always stay alert to these symptoms. They could be signaling a stroke. We've discussed the 9 critical warning signs of a stroke, from high blood pressure, a major risk factor, to sentinel headaches that can precede a stroke. We've underscored the importance of not overlooking sudden fatigue and weakness, confusion, and abnormal vision. We've also emphasized the role of stress in exacerbating stroke risk factors and the significance of recognizing numbness or weakness on one side of the body. Furthermore, we've established how dizziness and coordination problems, as well as unexplained nausea or vomiting, can be early warning signs of a stroke. Each of these signs is a crucial part of the puzzle, and understanding them could make the difference between life and death. In light of a 2017 study, we know that up to 80% of major strokes could be preventable with immediate medical attention. Remember, early detection can not only save your life, but also significantly minimize long-term damage. Stay safe, everyone. Safe.